What if I told you that some of the most effective pain-relieving systems on Earth aren't found in pharmacies, but quietly growing in forests, fields, and even your own backyard? Most people think of pain relief as a single category. Take a pill, block the pain, move on, but plants don't work that way. Some reduce inflammation, some block nerve signals, some change how your body processes pain, and others stop it before it even begins. Many of these plants contain compounds that have been studied in clinical trials, and in some cases, directly inspired modern pharmaceuticals. So in this video, we're breaking down 10 plants that act as natural pain relievers. But more importantly, we're looking at how they work, the actual compounds inside them, the mechanisms they use, and what real research says about their effects. Make sure you stick around, because plant number 5 works in a way very similar to a local anesthetic. And plant number 9 is one of the most effective options for bruising and soft tissue recovery. And the final plant doesn't treat pain at all. It helps prevent it from ever starting. If you enjoy uncovering the real science behind natural systems like this, consider subscribing. We break it down in a way that actually makes sense. So let's get into it. Number 1, turmeric. Most people know turmeric as the spice that permanently ruins a white shirt. What they don't realize is that inside that bright yellow powder is one of the most studied natural pain-relieving compounds on the planet. It's called curcumin. And in clinical trials, curcumin has been shown to reduce pain and inflammation in conditions like knee osteoarthritis, with effects in some studies comparable to common anti-inflammatory drugs. But here's the catch. On its own, curcumin has very poor bioavailability. Your body absorbs very little of it, and most gets broken down before it can do anything useful. For years, that made scientists question whether it could actually work in real-world use, until researchers discovered that combining it with piperine, the active compound in black pepper, can increase absorption by around 2,000%. Piperine slows down metabolic processes like glucuronidation, giving curcumin time to enter the bloodstream and actually take effect. And newer forms, like phytosomes and liposomal delivery, have improved this even further. So what is it doing in the body? Curcumin helps regulate inflammatory signaling, reducing the pathways that drive both pain and chronic inflammation. But not all turmeric is equal. Most studies use concentrated extracts with enhanced absorption, meaning the average form may not deliver the same results. And while it's generally well tolerated, it can interact with medications like blood thinners. So the real takeaway isn't just that turmeric works, it's how you use it determines whether it works at all. Number 2, ginger. Ginger might seem simple, but how it affects pain actually depends on how you use it. Fresh ginger contains compounds called gingerols, but when you dry or heat it, those convert into shogaols, which are even more potent anti-inflammatory compounds. So something as simple as making tea or using powdered ginger actually changes the strength of what you're getting. And it works. Clinical studies show ginger can reduce pain in osteoarthritis, menstrual cramps, and even muscle soreness. So the effects are moderate, but consistent enough that researchers take them seriously. Here's why. Ginger helps block key inflammatory pathways, including COX and LOX enzymes, while also reducing signals that drive pain and swelling. So it's not just masking pain, it's targeting the cause. And unlike turmeric, ginger is already fairly bioavailable, meaning your body can use it right away without needing special combinations. That makes it one of the more practical everyday options, whether you're using fresh root, powder, or a standardized extract. Just keep in mind, higher doses can cause digestive discomfort and may interact with blood thinners. Number 3, willow bark. Modern painkillers didn't start in a lab. They started in trees. White willow, Salix alba, contains a compound called salicin, which your body converts into salicylic acid, the same class of compounds that aspirin is built on. That's why aspirin traces back to this plant. Scientists didn't invent the effect, they refined it, making a faster and more consistent version of a pathway that already existed in nature. But willow bark works a little differently. Because salicin has to be converted step by step, the effects come on more slowly than a typical NSAID, and that slower onset shows up in the research. Clinical studies on lower back pain and osteoarthritis show willow bark can reduce pain and stiffness, often reaching similar levels of relief just over a longer time frame. But here's what makes it unique. Willow bark isn't just salicin. It also contains polyphenols and flavonoids, compounds that may enhance its anti-inflammatory and antioxidant effects beyond what isolated salicylic acid can do on its own. So instead of a single compound, you're getting a layered system working together. That said, it comes with the same precautions as aspirin. It can increase bleeding risk, irritate the stomach, and interact with medications like blood thinners. So dosing and form matter, standardized extracts are the closest match to what's been studied. Number 4, peppermint. Most plants on this list reduce pain by lowering inflammation. Peppermint works differently. Its main compound, menthol, activates TRPM8 cold receptors on your nerve endings, creating that familiar cooling sensation. But it's not just a feeling. That cold signal actually interferes with how pain is transmitted, so your brain registers less pain overall. And this effect has been tested. Clinical studies using diluted peppermint oil on the forehead and temples have shown real relief for tension headaches, with results in some cases comparable to acetaminophen. But here's where it matters most. Application is everything. Peppermint oil needs to be diluted, typically around 10%, and applied only to intact skin. Used correctly, it can provide fast, targeted relief. Used incorrectly, it can cause irritation or even a burning sensation, especially in sensitive areas or in children. So this is one of the few plants where how you use it completely determines whether it helps or harms. Number 5, clove. Clove has been used for tooth pain for centuries, and there's a reason it still shows up in dental settings today. It all comes down to one compound, eugenol. Eugenol acts as a mild local anesthetic, meaning it can actually block pain signals right at the nerve. So instead of just reducing inflammation, it temporarily numbs the area. And it doesn't stop there. It also targets inflammatory pathways, helping reduce swelling and irritation at the same time. So you're getting both immediate relief and a longer-term effect underneath. That's why clove oil has been so effective for toothaches, long before modern anesthetics were widely available. And clinical evidence supports this. Topical eugenol has been shown to provide short-term relief for dental pain, which is why it's still used in some dental products today. But this is where you need to be careful. Clove oil is highly concentrated. Used undiluted, it can irritate or even damage tissue, especially in the mouth. And swallowing concentrated amounts can be toxic. It can also affect blood clotting, so people on blood thinners or with certain conditions need to be cautious. So this is one of the strongest natural pain relievers on the list, but it's also one where proper use really matters. Number 6, aloe vera. Aloe vera is best known for cooling sunburns, but it's doing more than just soothing the surface. Inside that gel are bioactive compounds, especially polysaccharides like acamonin, that reduce inflammation, support tissue repair, and provide mild pain relief at the same time. And that combination is what makes aloe different. It doesn't just ease pain, it helps the skin actually heal. These compounds regulate local inflammation, while the gel forms a protective, hydrating barrier over damaged skin, so you get less pain and better recovery. And this shows up in the research. Topical aloe has been shown to reduce pain and speed healing in burns and skin irritation, which is why it's widely used in wound care products. But there's a limit. Aloe works best on surface level injuries, not deep or chronic pain, and how you use it matters. Fresh gel or properly formulated products are safest, while the yellow latex layer should be avoided. It can irritate skin and act as a strong laxative if ingested. So aloe isn't the most powerful pain reliever on this list, but it's one of the few that reduces pain while actively supporting healing. Number 7, capsaicin. Capsaicin is the compound that gives chili peppers their heat, and it might be the most counterintuitive pain reliever on this list because it works by causing pain first. When applied to the skin, it activates TRPV1 receptors, the same ones that detect heat, triggering that familiar burning sensation. But here's where it flips. With repeated or high-dose exposure, those receptors become less responsive, and nerve endings release less substance P, the chemical that helps transmit pain. So over time, the signal itself gets weaker. Not just masked, reduced, and this is well established. Capsaicin is used for nerve pain, post-herpetic neuralgia, and muscle pain. Low-dose creams give short-term relief, while high-strength 8% patches can reduce pain for months after a single treatment. But there's a trade-off. That initial burning is real, sometimes intense, but it fades as desensitization sets in. Used correctly, capsaicin is one of the few plant compounds that can actually change how your nerves process pain. Number 8, boswellia. Boswellia, also known as frankincense, might look like something you'd burn as incense. But inside that resin are boswellic acids, compounds that target inflammation in a completely different way. While drugs like ibuprofen mainly block COX enzymes, boswellia works on the leukotriene pathway by inhibiting 5-LOX, and that matters, because leukotrienes play a major role in joint inflammation and tissue damage, something many common anti-inflammatories don't fully address. So instead of doing the same job, boswellia fills in the gap. And this shows up in the research. Clinical trials on osteoarthritis show reduced pain, improved mobility, and benefits that build over time, not just short-term relief. Some evidence even suggests it may help protect cartilage. But there's a catch. The key compounds, especially AKBA, aren't easily absorbed, so formulation matters. Standardized extracts or enhanced forms tend to work best. So this isn't about fast relief. It's about targeting inflammation from a different angle and getting better results over time. Number 9, arnica. Arnica has been used for bruises, swelling, and impact injuries for centuries. And now we know why. It contains compounds like helenolin that inhibit NF-kappa B, a key regulator of inflammation. So instead of just treating the surface, it reduces the signals that drive pain and swelling. It also appears to support circulation, which may help bruises heal faster. And this shows up in research. Topical arnica gels have been shown to reduce pain and stiffness in osteoarthritis and are widely used for post-injury and post-surgical swelling. But there's a strict boundary. Arnica is for topical use only. Taken internally, its active compounds can be toxic, and it should never be applied to broken skin. So this is a targeted tool, used where it works best. And as we get to the final plant, we're moving into something even deeper, something that works by influencing the signals that trigger pain before it even begins. And finally, number 10, feverfew. Feverfew doesn't treat pain after it starts. It works by helping prevent it. This plant, Tanacetum parthenium, is studied mainly for migraine prevention, not immediate relief. Its key compound, parthenolide, helps regulate triggers involved in migraines, reducing abnormal platelet activity, limiting serotonin release, and calming inflammatory signaling in the nervous system. So instead of blocking pain, it helps stop the chain reaction before it begins. And that's exactly what shows up in the research. Studies, while mixed, often show fewer migraine days and reduced severity when standardized extracts are used consistently over time. But form matters. Standardized extracts are far more reliable than raw or homemade versions. And like everything on this list, it's not for everyone. There are side effects and interactions to consider. And when you step back and look at all 10 plants, a pattern emerges. These aren't just traditional remedies, they're biochemical systems. Salicin led to aspirin. Capsaicin became a prescription treatment. Eugenol is still used in dentistry. These compounds weren't adopted because they were popular. They were adopted because they worked. And while they don't replace modern medicine, they do change how you see it, because some of the most effective pain-relieving systems on Earth have been growing around us the whole time. If you made it this far, thank you for watching. I'm curious, have you tried any of these before? And if you have, did they work for you? Or is there one on this list you're thinking about trying next? Let me know down in the comments. And if you found this helpful, make sure to like the video and subscribe. We break down the science behind plants in a way that actually makes sense, and I'll see you in the next one.